and need assessment and costing methodology work by the WASH and Education in Emergency clusters at subnational level in the Department of Norte de Santander. The context that motivated us to do this work was that one of the measures taken by the Colombian government to address the COVID-19 emergency was the closure of school, which left approximately 108,000 boys, girls, and adolescents in the Department of Norte de Santander without presential education, affecting both Colombia and Venezuela refugees and migrants. Due to the lack of access to services and technologies such as internet, computers, and cell phones, these measures generate greater effects on the most vulnerable communities in this territory, such as rural communities, which had already been affected by armed conflict, natural disaster, and mixed migratory flows from Venezuela. This situation affected other rights like food security, because schools were the place where the most affected and in need children could intake the needed nutrients. Also, this measure exposed them to protection risks due to possible recruitment by illegal armed forces, child labor, and gender-based violence. The return to school was not a priority in the government plan to reopen activities in the country, based on the impossibility of guaranteeing a safe return, partly due to a lack of information that could show the need for access to WASH services and elements, as well as financial requirements to solve this gap. This evaluation was needed because by identifying the needs in water, sanitation, and hygiene in school, we could guide the necessary interventions to decision makers, I mean for a safe and timely return to classes. Also, because we need to give useful information on what should be done, we need to identify the approximate cost of the intervention in the school with the most critical access gap. It is important to say that this process had into account the technical standard and on the installed capacity that were already approved by Ministry of Education. Now we are going to mention with whom we did this and what role each actor played. This process was planned in 2 phases and 3 steps. The first phase was the need assessment, and the other phase and steps were to prioritize and the costing methodology. The first phase, the needs assessment, was led by the education sector, and the other phase was led by the WASH cluster. The methodology needs assessment was structured by the Norwegian Refugee Council, who is a partner of both clusters, and the methodology for costing was structured by UNICEF. It is important to say that in the subnational level, the sectorial leaders are the Departmental Secretary of Education for the Education in Emergencies and the Departmental Institution of Health for WASH. Also, in the implementation, we have the support and input of national and international NGOs, government, and UN agencies. First, we are going to have a glance on the methodology for assessing the school's needs on WASH. This methodology consisted of a survey of 91 questions. 17 of them consisted of a general information question such as location, quantity of students, teachers, and other staff. 39 questions consisted in other important aspects for the education sector, such as internet connection and the availability of computer and smartphones in the households. But there were 35 questions specifically on WASH, such as the presence of water and sanitation services at institutional and community level, other water sources, water quality, hygiene products availability, among others. The survey was to be completed by the school principals. The survey was sent via email or WhatsApp along with the instructions. A few days later, a collaborator of the sectorial partners played the role of a facilitator who guide the principals in the completion of the surveys through a phone call. What we found a worrying scenario. From the 1,877 schools, 78 of them lack access to drinking water. 74 required to increase the latrine capacity. 30% lack hand washing stations. 80% lack hygiene products such as soaps and towels. And we also found that 79% of the schools did not have connection to sewerage. 7% did not have any latrine or sanitation solution for excretal dispositions. And only 19% of the schools had access to water once a week. Most of these needs exist previous COVID. In fact, one of the factors that helped to accelerate the creation of this methodology in 1 month was the previous work between sectors, because previously we tried to elaborate a methodology to assess WASH needs in schools. This is a good opportunity to stress that for us as WASH practitioners, this kind of diagnosis and evaluation are living processes with milestones, meaning that normally the processes achieve some results, and from these results, we build to get to another milestone. So it is to say that the result found on the survey is one milestone, because at the beginning of the process, the costing exercise was not part of the original plan. But when we saw the magnitude of these needs, we didn't know where to start. So as a first step, we understand that we must prioritize schools and determine an approximate cost of the intervention, because with this information, we could do advocacy at the territorial and national level. Saying this, the WASH sector decides to lead a costing methodology. The first step was to identify the school with the most urgent need to reopen due to the already identified needs and contextual situations such as those schools in remote rural areas, those in communities heavily affected by armed conflict, schools with an increase on Venezuelan migrants and refugees students, and schools in communities that already lack of WASH services. We collect this contextual information from secondary sources such as humanitarian needs overviews, situational reports, and other information from OCHA, and from the coordination platform for migratory flows from Venezuela called in Lacro region R4B. Once these schools were prioritized, the sector collected information on 79 WASH interventions that took place between October 2018 to June 2020. These interventions were on a school, health center, shelter, protection center on Norte Santander. And the goal with this information was to identify each project final budget. Also, previous to COVID-19 outbreaks, UNICEF and its implementation partner, Halud Foundation, conducted a 40 structural WASH diagnosis and its correlative budget on a school in the same territory. Based on this intervention, there is a database of the real cost of WASH interventions according to the type of WASH infrastructure improved. These budgets were divided by the number of people reached according to the installed capacity standard of each intervention. With this information, it was possible to identify an investment index per beneficiary based on the cost and installed capacity standard of schools. It is important to say that in North of Santander, we can find very different realities depending on the geographical infrastructure and contextual conditions between municipalities and between rural and urban areas. So the result was a different index in areas with similar conditions. This allows us to extrapolate the index to the schools in needs within determined areas. So now what are the main results? First, 179 schools were prioritized in 2 different zones. The first zone is the sub-region of Catatumbo, which has 11 of the 40 municipalities of Norte Santander. According to OCHA, this is one of the most affected areas by armed conflicts in the country. It is also a host community for Venezuelan migrants and refugees. And in these regions, 93 schools were prioritized based on their needs. The second zone was the Cúcuta metropolitan area due to the high number of Venezuelan migrants and refugees that attend school in the 5 municipalities that are part of this zone. In the region, 83 schools were prioritized. The cost index by a student in Catatumbo is $87, and this area has 9,253 students with acute needs of improvement in their access to WASH services. The total estimate cost of this intervention is approximately $805,000. In Cúcuta municipality, in the Cúcuta metropolitan area, the cost index by a student was $30, and there are around 25,667 students and a student. The approximate cost in this area is of $770,000. I need to clarify that this budget is in US dollar with an exchange rate of 3,700 pesos per dollar. Also, it is to say that this is an exercise that gives a technical approximation to the real cost. So once the school to intervene is select, new costing should be made depending on the institute diagnosis, design, and blueprints. But we know that this is a reasonable approach for decision makers. To finish, I will share with you how we done with this information. First, we did advocacy in North of Santander with the North of Santander authorities trying to accelerate the process of school reopening. We helped them to identify a school that can be opened with little intervention, but also we helped them to place in the plan for the gradual return to classes budget for institutions that are more in need. Second, we did advocacy with the sector and get sectorial partners such as UNICEF, Action Against Hunger, and Halu Foundation to start projects on WASH in some of the most needed schools. And third, we realized that the impact of this costing methodology, so we start to compile WASH needs information of schools of other 6 departments to have an approximate budget for them. Recommendation and conclusions. To conclude, we want to stress the importance of previous intersectoral work in these 2 phases. The previous work between WASH and education on agreeing on installed capacity standards and preparing a previous assessment methodology helped to have a fast evaluation with very little changes that had results on the first 3 months of COVID-19 in Colombia. Also, it is important to integrate public authorities and motivate them to lead this process. This ensures good political disposition to use these results. The other recommendation is to invite sectorial partners to share the historical budget of the project in a transparent environment, and more important, to have an archive of this budget, to have information that allow us to apply methods